Hi, I'm Dr. Diane Hayden, publisher of Natural Nutmeg magazine and Essential Naples magazine, and I'm excited to have with me today Dr. Michael Duben. He graduated magna cum laude from NYU and attended Mount Sinai School of Medicine. He completed his residency at Montefiore and Mount Sinai hospitals and obtained his endocrine training at the Albert Einstein College of Medicine, Montefiore Hospital. He's a clinical instructor at the Albert Einstein College of Medicine, is board certified in diabetes, endocrinology, and metabolism, and has been in private practice since 2003. And he finished his functional medicine training in 2024, and he is a functional endocrinologist down in Fairfield County and here in Connecticut. And so I wanted to start with that, Dr. Dubin, because I think that most people have probably never even heard of the term functional endocrinology. And so I wanted you to talk a little bit about, what that is. And I I've said this to you many times, I'm going to say it again. I love that you're doing that because I feel like we need more medical doctors that are, starting to focus more on functional medicine and healing the body alongside traditional models if that's needed. So tell us, what is functional endocrinology, and how did you or why did you decide to kind of move your practice in that direction?
Sure. Hi, it's a pleasure to talk to you again. Um, it's not like I invented a new term or a whole new field. It's just a natural evolution of my own practice. I am a trained endocrinologist, board certified, and I've been in practice since 2003 after completing my fellowship. So, it's a cliche that you never stop learning, but one of the things that you discover in your practice, unless you lose interest completely, is that how much you still don't know. And it comes to you slowly. You go through phases, I guess. First, there's uncertainty, then you gain confidence and all that, and maybe even fall into sort of a rut. And then certain things happen. Some people just have an epiphany. Some people are pushed to it, so it comes from within. Some people are brought to this by other circumstances. But, one way or another, you tend to realize there's still a lot of things you don't know. And so in my case, it was just a gradual evolution of seeing what traditional medicine can do and what it cannot. Functional medicine, initially, I kind of dismissed it as almost a semi voodoo. It's misrepresented a lot in traditional medicine and dismissed, and I'm guilty of that. I was in the beginning, but when you realize shortcomings of your own field, like for example, I mentioned before the atrocious food pyramid, and you just come to a realization that the so-called experts, people are genuinely smart, but it's not the IQ competition. It's whether your advice actually results in tangible improvement. When you realize very quickly in my fellowship that this food pyramid is the exact opposite. For example, what is needed for a diabetic, right? But that's touted as science, and you cannot question it. That's just probably the first seed, and there's more, and then there's COVID, and you eventually just realize that, well, you certainly not only do not know everything, but you don't even know what you don't know very often. So I've heard about functional medicine, and some of my colleagues have mentioned it. When you keep hearing it, you become curious. It's like, all right, so what is it? And I decided to initially wanted to only take hormonal modules. They have modules,
Mm.
7 of them. One is generic, and then they're specialized. One of them is endocrine. But I started with cardiometabolic, which was offered first, and it just became obvious to me that this is a rigorous field, but it goes deeper and wider simultaneously than traditional medicine because it genuinely tries to address the root of the or the cause of the problem and eliminate it if possible. But also goes wider because it doesn't just look at symptoms or biochemical pathways, let's say, but it looks at the entirety of the patient. And it became clear to me very early on, well, before I even started, like sleep is super important, and diet is very important. I always had, diets available in variety of them to the patients, and we always try to address sleep. It just confirmed what I already knew, but took it to a different level.
Hmm.
The another level was nutraceuticals, supplements, vitamins that you had relatively little. I mean, we obviously learned about the function of vitamins and all of that, but as far as nutritional training, for example, it's just completely lacking and atrocious. And I remember, I don't know if it's still the case in medical school, probably less so, but still, you're told, well, if you eat a balanced diet, all you need. You get all your vitamins, and well, okay. And I kind of parroted that for a while.
Right.
Certain vitamins you need under special circumstances. There's certain drugs that deplete certain vitamins, and there's vitamin D is a special category a bit because it's sun-based, and on in pregnancy. But what they don't teach you in medical school is that the food supply is so compromised, it completely, if it's just standard commercial, food supply, it lacks almost all the micronutrients that you need, and then biodiversity of it. And so, no, you don't get all the nutrients and vitamins and other beneficial substances. A lot of them you don't even learn in medical school. And yes, you need to supplement it, but you need to know how. And it's really a hybrid of knowing the metabolic pathway. What really impressed me in the teachers in Institute of Functional Medicine is their deep knowledge of metabolic pathways. This is no joke. They just can't rattle off whether it's a Krebs cycle or a fatty acid oxidation and so on and so on, bring it to clinical relevance. It's very impressive. But on top of that, they add nutraceuticals, herbs, supplements, various vitamins that can optimize. And the key word is optimize health. So, and you look at all the other aspects, stress, with its attention to the adrenal system. They're very big on adrenal system and adrenals, whole endocrine system as such. It's just a wider and deeper look, and it really impressed me. So I had a thought. So why don't I combine what I know already with this new field and offer it to those who are willing to do the same, combine traditional approach. They don't deny the value of traditional medications. It's just not everything. It's just one of the tools available. And so it became very attractive to me. I'm kind of like a little bit of a quantitative guy, so if they can show me the data and impress me, and they had a lot of data to show, so I was hooked.
Yeah, yeah. And I think, so people might be wondering, okay, what's what should I expect? What's going to be, how is this going to be different? Why would I go see a functional endocrinologist versus just a traditional endocrinologist? And a lot of it, you said in the beginning, you mentioned the root cause. I think
Right.
it's getting to what you do that's different, and you can talk more about this, but is that you're really looking for what is the root cause of the problem that this person has, whether they have diabetes or it's obesity or there's hormonal imbalance, whatever it might be. It's why did this happen and how can we correct that versus, okay, well, they have this issue. I'm just going to give them this drug and maybe tell them they should change their diet and they should exercise and send them on their way. You spend a lot more time with the individual patient, an hour plus sometimes, I'm sure, or more,
Mm-hmm.
to really go through their lifestyle, right? And see, look
Right.
at all these things that you mentioned, like sleep and diet, and what are they doing for exercise, and
Mm-hmm.
what kinds of supplements are they taking, if any, and what looking at why is what did something happen? Maybe it could even be like emotionally related to cause this issue, let's say, and let's find out what that root cause is so we can fix that and then everything else kind of falls into place.
Yes, absolutely. It's everything you said. So what's different is the level of attention, and the amount of time dedicated. So the first visit is an hour and a half usually,
Hmm.
and we just try to explore. In fact, I decided, at least at the beginning, that I will start preparing even before the visit because when somebody calls and they had a problem they wanted to discuss, I asked them to fax me whatever notes, lab work, and so forth, and ask my secretaries to inquire what is the question, what you'd like to address. So I know ahead of time, what interests the patient, first of all. I think it's a two-way street a little bit because people who are interested in functional medicine, they're not just random people, they have no idea what it is. They already have knowledge and they seek out often uh, people in that field. So I don't need to explain to them. To those who are not uh, familiar, yeah, again, what you get is above and beyond just traditional Western medicine with medications and standard advice like, yeah, exercise and.
Hmm.
So there's just way more detail and way more attention to other things that people may or may not realize. I mean, it really is encompassing the entire kind of human condition. I mean, I don't want to sound too grand, obviously, but you
Yeah.
try to be comprehensive. You
And
know,
even the testing that you do too, I would be different, I think, than maybe even the type of blood testing or what you might be looking for or other types of testing that you might do is going to be very different than what someone might get if they go to a traditional endocrinologist.
often it is, of course, again, this being a hybrid, this is not just something completely different. This is still very much based on uh, the knowledge, the vast knowledge of traditional Western medicine. This is not throwing baby with a bathwater.
Hmm.
So a lot of testing can be traditional, but there's more. There's enough. Say if people want to explore more in depth, there because you also try to um, limit the costs to the people. So I use Questel quite a bit, and it's mostly covered by insurance. There are other tests available um, that are not covered by insurance. It just adds cost. It depends on what the patient wants to achieve. I am not yet fully, venturing into things like, gut health in depth. I mean, obviously it's addressed. It's absolutely one of the cornerstones of functional medicine. But as far as testing for it, gut microbiome and so on and so forth, and the various pathogens, those things I tend not to do. Yeah, because again, my specialty is endocrinology, so it's hormonal health, thyroid, diabetes, osteoporosis, adrenal, and so forth. But what's available to people is just more in depth. For example, in women's health, there are different estrogen metabolites that are available that you can measure that commercial labs simply do not offer, right? And if you want to know, if you're on birth control pills and you want to know if they're synthetic, which is, not often desirable, you can demonstrate certain metabolites that are known in traditional medicine to increase the risk of cancer versus certain other metabolites that do not. And you can actually demonstrate. It's not available in the commercial lab, it's available in third party labs.
Hmm.
And there are many examples of that. But fortunately, most of the things you need, except, maybe gut microbiome studies and such, a lot of things are available through commercial labs and they will be covered by insurance with the proper coding. So that aspect, at least, patients don't have to shoulder the financial responsibility for. But again, coming back to what I offer is uh, more time, more um, uh, depth, and more breadth. I'd like to engage in conversations. I'm mostly talking now, but I do listen, and we go back and forth, and they ask questions, and I answer to the best of my ability, and I try to educate people.
Yeah, I mean, but plus it's got to be so refreshing because most people are now ushered in and out of their doctor's office in
Oh,
like, 10 minutes and they probably don't even see the doctor. Now they're probably seeing a PA or an APRN, which is
or
fine.
if they see, and this is 9 times out of 10 at least, what they describe. And I even ask, it's like, so most of the time, the doctor doesn't look at you. The doctor
Yeah,
looks at the computer, and then it's like just fills up like the endless, you know,
notes.
boxes and
Yep.
whatever in the electronic. I don't have an electronic medical record. I never did, and probably never will. So I talk to them like I'm talking to you. I'm looking at you. You ask me questions, I answer. First I let the people talk because I need to collect information from them, and then is my turn, and then it's back and forth, whatever the topic or topics may be. So yeah, I'm free of that slavery with just looking at the screen all the time, and
Exactly.
that's good.
Yeah. Yeah. Yeah, exactly. So, I'm sure that some people are curious about what your feeling is around GLP-1 agents and do you use them and how do you, how if you do, how you do that in your practice. So, for people
Sure.
who don't know that, it's like drugs like Ozempic and that kind of thing. So, what's your feeling on that?
Um, it's slight bemusement, or at least it was in the beginning, because what struck me as weird in the beginning is the sudden peak of interest. In the world of endocrinology, we have known about and prescribed them and managed people with them just for diabetes since 2005. The first drug came out was Byetta. It was twice a day injection. It had to be done before meals for optimal use. And so we're talking 20 years ago. Now, I don't remember exactly. I mean, obviously, it was pre-COVID, but you know, uh, all of a sudden, and we always knew literally that one of the advantages is weight loss. So you basically achieved, two goals with one drug, and diabetes control and weight loss. And this was unique in that sense. Metformin, a very old drug, uh, is not a weight loss drug. You could get a little bit of a side effect of very slight nausea. So unlike most drugs in diabetes that can actually promote weight gain, um, if you're weight neutral, it's a huge benefit. So metformin, there's some other medications that are weight neutral, like DPP-4 inhibitors and SGLT, so Jardiance, Farxiga, maybe you've heard their ads probably.
Mhm.
Um, Januvia, which is a different, this is DPP-4 inhibitor. They're weight neutral. That's great. And so when you got something that promotes weight loss, it's just an explosion. So they were very popular. And then Victoza came out. It was daily. It was a big improvement because instead of twice a day, you do once a day. But if you give people anything that will, make them or help them lose weight, they'll inject it, 5 times a day if
Of
they have.
course.
But still, once a day was better. And then eventually, so this was around probably 2007-ish when Victoza came. It was a long time ago. Then you had these weekly, all of a sudden. Um, it was Bidurian was another drug. It kind of like disappeared. There was one drug went off the market. They're probably, you know, regretting that now. But they couldn't compete. Those Tanzium. Anyway, these drugs appear. Initially, with a weekly one, I was worried about maybe prolonged side effects, but they were mostly well tolerated. And Ozempic came out, and then everything, Trulicity, and then the latest kid on the block, that was already, I believe, during COVID, it was Mounjaro. But the interest was from the celebrities
Right.
because, if they need to lose weight, they just all stops are taken away. And they promoted that thing. So, and that's why it moved from diabetes to general public. But for an endocrinologist, it was like old news. So it was
Interesting.
just like you are now finding out that this
Right.
drug existed. About at the time, I think it was already, well, at least 10 years, if not more. So endocrinologists are very, by nature, comfortable with these drugs. I view these medications as tools, right? So if you have a hammer, you can bang your finger with it, or you can drive a nail into the wall and do something useful. You can even murder someone. It's just a tool. It's how you use it. Same with GLP-1. I don't worship them, but I also don't hate them. I think it's just silly. You don't hate a hammer, right? You don't hate any other tool. So if you know how to use a tool, you use it when needed, right? So uh, it's something that's available as an option to those who need it. What I do, I simply explain how it works, why it works, and what to expect when you stop it. What are the side effects? How to minimize them, right? One other thing that just to share with you that really, again, another source of amusement is how the drug is blamed, like literally blamed or criticized, let's say, for what happens after you stop it. And so, well, and the argument goes, okay, so you're going to take this drug, it decreases your appetite, you lose weight, and then you stop it, and then you gain the weight back. So the drug is bad.
Right.
And I go,
No, that's the
why?
lifestyle.
Like, but okay, how about we use the same logic and say, okay, listen, you go to the gym, you exercise, and you become muscular and healthy and all that, and then you stop going to the gym and you turn into a couch potato again. So exercise doesn't work.
Right.
No,
Exactly. Yeah.
it does work when you do it. Or if you stop going to work, there's no money coming in, so working is useless.
Right.
Okay.
Right.
So the same logic would be laughable, but when applied to medication, I think the misunderstanding may come, I'm speculating here, may come from thinking like certain drugs, like if you are infected with bacterium, you take an antibiotic, it kills it, and then you don't have to take the antibiotic. The problem is gone, right? So you don't need an antibiotic. Now, if the antibiotic doesn't kill the bacteria, well, that's the wrong antibiotic, and it's not going to work because it's wrong selection. Okay. I think maybe, okay, this is my, people think, well, I lost the weight, so the problem is gone. What they don't understand is, again, it's not some magic. The way it works, it suppressed your appetite. But if you take away the drug, your appetite tends to go right back up to its baseline. The body is a self-regulating, infinitely complex mechanism. And self-regulating is the key. It just, there's certain set points that the body tries to return to. Okay. And appetite is definitely one of them. Throughout the evolution, appetite is what allowed you to survive. If you don't have an appetite, you're not going to look for food, you're going to die because there's food scarcity. So your appetite is so ingrained into the deepest, corners of metabolism. It's just fundamental. So you can suppress it temporarily, right? And but if you do nothing else, if you don't retrain your mind, how you treat food, what kind of food you take, when you take it, how you take it, and everything else, your appetite is just going to come back exactly to where it was. And guess what? Your weight is going to go back. How do you blame the drug for it? I don't
Yeah.
understand. I
No,
think
I
it's
know.
just from not understanding how it works, and I try to explain it to people.
That, and also I think people are always looking for something outside of themselves to be the fix instead of realizing, like you said, this is a tool, but you also have to change your lifestyle if you want to
Yeah,
make lasting changes, right? Like
right.
everybody just wants to take the drug and not have to change anything else that they're doing. It doesn't work that way. Like,
No, it doesn't. And that's
yeah,
why you're not always the most popular guy if you take their favorite foods away.
yep.
But again, I think, people who tend to gravitate towards functional medicine, they understand, or at least they're somewhat aware of this. It's just a regular patient, and I don't even necessarily blame the patient for this. It's my colleagues. It's actually institutions,
Yeah.
like American Heart Association, American Diabetes Association, a profession as such. Plus, of course, big food and advertisers and all of that. So you create a situation where food is literally addictive. It's like a continuous dopamine hit, right? And so by design, it's delicious, calorically dense, and you get what you get.
Yeah, exactly. So before we started our recording, we were having a little chat, and you were saying to me that you use AI in your practice.
Right.
So yeah, I was like, oh, I'm going to ask you that question. So how do you use AI?
Oh, sure. Thank you for bringing it. Well, I just started it, right? So I think it's just an exciting, again, tool, right? You just have to know its limitations and know what it can and cannot do. So it's just we talked about Google University, but it's the next step. It's something that doesn't just give you links. It literally kind of summarizes and talks to you. It has access to virtually unlimited information and packages it for you. No, so the key here is know what to look for and to know how to ask questions. They call it prompting. The more detailed parameters you give it, the better answer you're going to get. So if you get an open-ended question like, wow, what's the best drug for diabetes? I mean, first of all, there is no such thing, right? I'm sure it'll generate something for you. The tendency is for people to take a written word at face value and really believe. That's why, if it's something on the internet, well, somebody wrote it, so it must be, true, especially if it has an MD degree after it. And so it's, excuse me, turn off my phone. It's a tool that you need to know how to use. But if you know how to use it, it's super helpful because whatever question you have in mind, let's say, nobody can keep all the metabolic pathways in the head. Nobody can keep just a vast amount of information readily available to them at, on demand. So this is what it is. It's ability to literally enter just about any published information, summarize it. I'll be right back. Sorry, family members forget that I have a podcast. But anyway, if you want any reminder, any clinic or certain things, again, are outside. A lot of things are outside of my area of expertise. If you want a quick summary, you just ask questions today in a regular endocrine practice. I had a patient who was told he has liver fibrosis. I know obviously about non-alcoholic fatty liver disease. It's a big part. It usually accompanies obesity. Now, but there was a different aspect. It was from gastroenterologists. They use the testing I don't do. It's called elastography. It's a special ultrasound, and they have special markers. To me, what was bizarre was that the man was not overweight. He was very athletic. He didn't have fatty liver that I used. All his liver tests were mostly normal. And they were telling him these livers at the end of it just didn't make sense. So I started looking and I asked, Grok about certain things, and it gave me a very good. And then I asked about the studies because my advice to him was to use NAC with glycine to boost glutathione, which has properties of reduction of reactive oxygen speed. So basically, reduce inflammation, which is usually the driver of fatty liver. And so I asked Grok about studies specifically for that, and he gave me a great answer, right? And I presented it to him. He was very impressed. It confirmed what I knew, but on a different level. It just tells you the studies, tells you this was done with animals, this was done with people. There's certain areas that still, merit investigation. This thing didn't work. I mean, you can get the same, but it will take you forever to do, Google Scholar searches and look at every article. It's like having a very smart fellow who works for you, the trainee,
lab assistant,
especially like an assistant who just like gets it for you instantly. Right. So that's what it is.
Yeah, that's awesome.
And it's very exciting. It probably at some it will replace me. Not yet.
Oh gosh, we hope not. We hope it never replaces the human
Well,
interaction.
it's certainly a great help.
Yeah, no, no,
But
for sure.
I I just love the fact how easily I can access information. But again, I know how. I know the questions to ask. I also know how to interpret the data, right? And so I just for fun sometimes because it's literally at this stage and it's developing super fast. You can have a conversation with it. You can have an argument with it. It just follows logic. It argues like a pretty smart individual. So you can literally make it change his mind. And I played that game with obesity and PCOS argument. And I kind of like it admitted that, yeah, mostly obesity causes PCOS, not the other way around. There's a little bit of element of that. But if you know how to present an argument, you know how to and how to package an argument, it can agree with you, for example. So
Right.
it's
Yeah.
exciting.
Yeah, it's interesting. So I'm
Right.
sure that we have piqued people's interest with this about, functional endocrinology. So how can people connect with you? You want to send them to your website or any
Yes,
contact
absolutely.
information?
So my uh, uh, office, the LLC their firm is called Restore Health. So they can go to restorehealthmd.com. And all information there to call the office at 203 760 5544. Schedule an appointment that way. All information about me, fee schedule, and all that is on my website. So, yeah, the door is open. I'm excited. It's a new field, kind of keeps me, on my feet and sharp. I like that. It's a challenge. There's a lot to learn, and but I'd like to, do it with my patient. My first patient was a 91-year-old, very healthy man with certain things he needed to tune up, but
Wow.
you can be very vigorous and very healthy at pretty advanced age. It's totally possible if your
That's
goal
amazing.
is health and not alleviation of symptoms only. So that's
Right.
what I try to do.
Wow, that's amazing. That's inspirational for sure. Awesome. So your website again, restorehealthmd.com.
Okay.
People can
Yes.
go visit that. And thank you for all of your time today and the great information. I'm excited
Thank
we
you,
had another
Diane, for
chance to
the
talk.
opportunity. I appreciate what you do very much.
Oh, thank you so much. And thank all of you for listening. And you can tune in here all the time to listen to our other expert practitioners from Natural Nutmeg and Essential Living. Thank you so much and hope you guys have a great rest of your week.